Good morning, and thank you so much for joining us for this edition of SBB Live. I am your host and the publisher of Seniors Blue Book, Amanda Barton. Really excited today to bring on one of our brand new partners. We have Terri Bowes, who's joining us this morning. She is a geriatric care manager, just entering the Sarasota market, but has an incredible story to share about what brought her here. Terri, good morning. How are you?
Good morning, Amanda. I'm great. Thank you. Thank you for having me.
Absolutely wonderful. It's so good to have you. I love hearing your story. Tell us the name of your company. Tell us what brought you into this industry and a little bit about yourself. This is an opportunity for us to introduce you to our viewers and our readership. So take it away.
Sure. Thank you. So as you said, my name is Terri Bowes, and the name of my company is Senior Care Associates. I am a geriatric care manager. And part of why I get into this, aging is hard enough. And so what Senior Care Associates is poised to do is really help older adults and their families work through this aging process, because we know it's very emotional, it's very complicated, it's very fragmented, and it's very stressful. And so what we try to do and strive to do is just help to bring information, bring empowerment, and make sure that older adults' lives continue to be enriched. So I really act as a trusted advocate in helping people decide how they want to age, where they want to age, and help them with connect them to those resources. So a little bit about me and how I got into this.
You have such an incredible story that brought you here. So yeah, tell us your background. It's impressive. So we want to hear a little bit about that.
Yes, thank you. And so the company's new, and I'm new to the Sarasota area, although my parents have lived here for 15 years. So I've been coming down here as often as I can, but I'm not new to this industry and serving older adults. I am a registered nurse. I've been a registered nurse for 28 years. And for over 20 years, I've been a certified case manager. So in both of those things, I have experience in dealing with complicated and complex medical issues and understanding those issues. And also not just the medical part, medical and physical, but also the psychosocial and social aspects of managing and working with people. I am a professional in healthcare management, which is a certification I've learned. I have a lot of experience in the managed care industry. So I have been trained and worked and understand the complex medical insurance industry. So I am poised to help, again, older adults and their families understand, doctors and referrals and appeals and denials and EOBs and all of that kind of information, which is, again, is just extremely complex. I have a master's degree in business administration with a concentration in healthcare. So again, I've been trained in the business side of things. I am happy to be a new member of the Aging Life Care Association. So I've been vetted, my credentials have been vetted by them, and it's a national association of people like me that I can call on, and experts in the field. And I'm also a subject matter expert and consultant in long-term care nationwide for health plans that are trying to learn this business. So again, I have a wide breadth of experience. For most of my career, I've been working with older population and people with physical disabilities. So I love this population. I have a real passion for it. Some part of my why is I think most of us know someone, whether it's our own family member, relatives, friends, that have gone through an aging process. I've had my in-laws who both battled dementia and Alzheimer's, and my mother-in-law who had Alzheimer's was the caretaker for her older husband, my father-in-law. She was 12 years younger, and it was a very long, emotional 6-year battle. My own dad has prostate cancer for the second time and has multiple comorbid conditions, chronic, and helping to take care of them. It's just so difficult. There's so many pieces. There's so much to put together. And I think to myself that I know a lot of the resources. And I understand this industry, and it's still difficult for me. And so every time I'm working with people, I think, what do those people do that don't have an advocate, that don't have someone to help them navigate this system? And it just breaks my heart when I think about that. People either being taken advantage of, or not getting enough information, or even not being given enough because
Well,
people
and
think they're
maybe
old enough.
steered in a certain direction.
Absolutely.
So I just have one question for you, Terri. What
Sure.
haven't you done? That
I,
is
you know,
quite an
I
impressive resume, my friend.
thank you. I really, I really love this work. I love what I do. I love helping people. Part of being the nurse, getting into it, is just, I just have a passion and a calling to help people.
Yeah,
That's what I like to do. And when you like to do something, it's not a job, it's not work, it's really service.
yeah.
And that's what I'm here to do. I'm here to try to serve, as much as I can while I'm
Yeah.
here.
I think a really good example for any adult children out there, or even seniors themselves, is I like to think of you as the clinical daughter that they never had.
Hmm.
You being able to go to the physicians with them, decipher what the doctor's saying as a nurse on a clinical level, and report back to the family that maybe lives out of state, or
Yes.
even if they do live in town and they're just busy with their lives and their children, and they want someone that really knows what's going on and how to discuss it with the clinician. So it's a really valuable piece of the puzzle that I think everyone could benefit from having that care management piece. And what an experience level that you bring to the table, especially with understanding the insurance coding, understanding long-term care insurance policies. Having all of this background is going to make you such a special addition to the family here in Southwest Florida, in Manatee, Sarasota, and Charlotte County. So I am so excited to introduce you, Terri, and your new company, Senior Care Associates. Thank you so much for joining us this morning.
Thank you so much, Amanda. I appreciate it.